Hello again. I'm Dr. J.C. Smith here at Smith Mental Care Center in Warner Robins. Today I'm with my best patient, Kenya, and she has an incredible story to tell. When I first met her, she could hardly walk. Certainly couldn't stand up straight.
Not at all.
And after a series of adjustments and exercises, we got her back on her feet.
Yeah.
Tell your story.
So I think the end of May 2020, I couldn't walk. I couldn't sit down. It was terrible. So my sister and I looked up on Google and we saw your center, and I was like, well, let's look at the reviews first, because I have to. I just can't go
People
to anyone.
like reviews, don't they?
Yes. So I was looking through it and I just read everything, how everyone's saying you changed their lives, you made them feel 110% better than they did before, and I was like, well, let's give it a try. So then I walked into the center, and the first day you just made me feel so good, because you said, you know what, this can be fixed. And not only did you encourage me not to do like the medication, you told me I could do it naturally, and I had to change my eating habits, try to eat inflammatory foods. And when I say that was the number one thing that really helped me change, and then doing exercises at home, and then you just teaching me, educating me on how to prevent back injuries was a true blessing to me. And I went from not being able to walk to, in 2 weeks, walking 50% better. And then now I don't even have to wear a back brace anymore. I'm able to just walk. I'm not running yet, but I'm doing a lot better with walking, and it's been a great experience, and I'm so thankful that God placed me to come to this center.
Oh, you're welcome.
Yes.
What was the most shocking thing you thought of when you saw your x-rays?
That at first I thought I had scoliosis, because my back was kind of crooked and going one way and the other, and I was just so, I don't even know how it happened. I was so shocked. Like, I was just sitting down, and one day I tried to stand up and I hit the floor, and I couldn't understand that. So when you just explained everything to me, I was like, wow, that's something small that I probably, when I was young playing sports, I could have had that injury happen, and I just didn't know until talking to you, and you explained everything to me, which now I know. I feel 10 times better than I did before I came into the center. So.
I know the study showed that 3/5 of adult problems begin in youth, when kids fall off bicycles, roller skates, play volleyball, football, cheerleading. So they misalign their spines then, but it goes unseen, uncorrected, because the body is a self-healing organism. Inflammation and pain will subside, but the misalignment remains. And then 10, 20, 30 years later, they come to see me and say, but all I did was sneeze. You know, that was the trigger, and this mechanical problem, it's a buckling effect. The joints go jam, and you suddenly are on your knees, like you said. But when you listen to my world famous CD, what did you get out of it the most?
4 principles, there we go.
That's right.
Alignment, strength, flexibility, and compression were the 4 things that I needed to learn, and honestly, that helped me so much. I even tell my parents about it now.
Videos we now have, they're really educational. Have you seen any of those?
Yes, I have, yes. I think it was a gymnastics young lady that was the first one I saw. And she was talking about having scoliosis and how she came to see you. That was the video that actually got me here, because I knew if you could make her feel a lot better, then I know I had hope there, so. Yeah,
she had a 30-degree scoliotic curve.
Wow.
That's when they want to start putting rods in your back. She didn't like that idea.
I wouldn't either, not at all.
So she came to see me, and we adjusted her, and she's doing great, but she still has a scoliotic curve. So again, it's not what your spine looks like, whether it's a bad disc or a bone spur or scoliosis. It's how does the spine function?
Correct.
And that gets back to the 4 principles. The joints should be aligned, strong, flexible. Joints are supposed to move, and hopefully you can decompress it, because most people just sit all day and compress their spines, or they fall on their butts or whatever, and then they wonder why they're having a back attack. So everything we do here is designed to realign the joints, restore flexibility, what's technically called joint play.
Okay.
You didn't know your joints are supposed to play, did you? Yes, the more they play, the happier they are. And then decompress it, and then of course you got to strengthen it. Luckily you're athletic, so as you gracefully age, if you don't maintain your core strength, then like the old comedian Bob Hope once said, you know you're getting old when your back goes out more often than you do. That's funny, huh?
Yes, I agree.
Well, let me ask you a simple question. If you had a friend or family member that was having a back attack, and you knew they were skeptical, what would you tell them?
I would definitely tell them to come see you. I would recommend coming to Smith Spinal Care Center because it's life-changing, honestly. For me, not being able to walk, in 2 weeks walking better, 50% better, and then another 2 weeks 100% better. You just educate people on how to take care of their back, and that is something that I think everyone needs in life. They need to know how to educate themselves on health, and you do that. So I definitely highly recommend coming to Smith Spinal Care.
Good, thank you.
You're welcome.
Well, anyway, I hope you enjoyed Kenya's testimonial, and hope you come by and have the similar experience that she's had and make you feel like you're 19 years old again. Thanks for watching. See you next time.
Bye.